With many experts agreeing that COVID-19 will eventually become endemic, things are returning to normal after 3 years of antivirus measures. But we are still under a public health emergency, as declared by the World Health Organization in March 2020. Now, on Friday, the WHO will decide if the COVID-19 pandemic is still a global emergency. For more, we are joined by Professor William Schaffner. He's a professor of infectious disease at Vanderbilt School of Medicine. Welcome to the program.
Good to be with you. Good morning.
Good morning, and good evening to you. Now, a public health emergency of international concern is the strongest alert that the WHO can issue. Now, how likely is it that the international body will say COVID-19 is no longer one? What are some of the variables and factors that the WHO will look into before making its final call?
Yes, well, I expect there will be considerable debate on this point because although many countries have moved from pandemic to endemic, it's really quite clear, for example, that in China, we're currently seeing a pandemic because of the relaxation of previous restrictions. So clearly, the situation is not the same in every country around the world. And the fact that this virus is still spreading very, very widely in China, but also in other parts of the world, makes me hesitant. And so I wonder if it's a good idea to withdraw the concept of a public health emergency. Because usually what happens, then governments become less relaxed. They put more, they take resources away from public health, and the general public is less cautious about COVID.
Right, definitely different situations in different countries, especially China, can really make it a headache for the WHO can make its final call. Now, what actually happens then when the COVID-19 emergency declaration actually ends? What does it mean? I mean, will the decision make a difference in our daily lives?
Well, I think in some small ways, because different countries then will put less emphasis on COVID prevention and COVID treatment. And there could be outbreaks here and there, but many people then will feel much more relaxed and on a personal level will let their guard down. They may not be as apt to be vaccinated. They won't pay as much attention to social distancing. They'll take off their masks and they'll be much more relaxed. This may indeed provide further opportunities for this virus in its new highly contagious variants to spread.
Right, I agree with you, Professor. The word emergency itself sounds very daunting as well. Now, as of 2023, COVID-19, monkeypox, and polio have been categorized as public health emergencies of international concern. Now, why is it necessary to declare or keep viruses, like I mentioned, as public health emergencies?
The declaration of a public health emergency focuses the attention of not only the public health leadership on a problem, but the political leaders. And that obliges them to put more resources into fighting the infection at that time. If you withdraw the public health emergency declaration, then of course the opposite will happen. The political leadership will think the problem is finished. We don't have to put resources into this anymore. And there can be a resurgence of the disease in many countries.
Right. Even living in the endemic era, their role, politicians' role, still remains quite crucial. All right.
Yes.
Thank you for your time this morning and evening for you.
My pleasure.